Namaste and a warm welcome to all my colleagues from across the country and the world. The humanity today is facing a bigger ever medical crisis, and each of you, true to the spirit of medicine, is fighting the enemy, COVID, and making so many sacrifices. I am privileged and very pleased to express my appreciation and also share my thoughts about how we can together as a collective force to ride this tide. And after, on 14th of April 1957, it goes back when I got graduated from Stanley Medical College, and in my 63 years as a doctor, I have never thought I will see what we are seeing today. SARS-CoV-2, a 120 nm virus, has brought the world to a virtual standstill. We are fighting a war not just for this generation, but also for the generations to come. The novel coronavirus pandemic shows no borders, no distinction between region, religion, caste, creed, color, or social status. The pandemic takes on immeasurable toll of causing deaths and illness and economic despair. With more than 25 lakh people infected worldwide and 1.6 lakhs who have lost their lives, more than 200 countries in the COVID-19 pandemic shows no signs of abating. India, under the dynamic leadership of our Prime Minister Sri Narendra Modi ji, took several decisions to prioritize the lives of our citizens, and his leadership model has undoubtedly helped avert an outbreak which we have led to the loss of thousands of lives. In addition to his acknowledgement of healthcare workers being tapasvis is indeed a great motivation for all of us. In the words of WHO, the virus is an enemy of humanity, and I would add that therefore, as doctors, scientists, and members of the medical profession, we need to lead this war and defeat the seemingly invincible enemy. India has been staying at home, and you chose to step out and serve the patients in the hospitals. It's a huge sacrifice and it's humbling. Thank you, doctors. Colleagues, we're indebted to you. I am confident and optimistic that together we will succeed. We are happy to see that doctors and researchers come together across the globe and unravel the genome of SARS-CoV-2 in a few days. Diagnostic kits were developed rapidly, clinical and vaccine trials were initiated in record time, and our understanding has improved considerably in managing patients with COVID-2. We have now effective medication, newer novel therapies are emerging. Again, true to the spirit of medicine, the public and private sectors have come together and support. The government will launch Apollo Project Kavach, which Sunita spoke about, with the mission to identify, fight, and defeat this pandemic with clinical expertise and a comprehensive, multi-level, multi-stakeholder strategy. Adhering to the last telemedicine practice guidelines, as well as following the directive of the Prime Minister Modi ji in adopting remote care to have unleashed the power of Apollo Telemedicine Network, the world's largest telemedicine network, which has been launched by the previous President of the United States, Bill Clinton, today is the largest telemedicine network providing access to quality healthcare for anyone from anywhere at the comfort of their homes. Further, we have launched Apollo 24/7, a mobile app that's available for clinicians for offering consultative services to their patients and ensuring continuity of care. I welcome you all to join in this initiative to bridge the barriers of distance. Apollo 24/7 will help you reconnect with old patients and also assist you in new patients who would like to reach out to you. This connect will be seamless, the record access instantaneous, and in the follow-up efforts, it offers new hope in this time of crisis and a path to mitigate economic loss. Also, our capacity to remote manage patients with respiratory failure has been ramped up through our eICU service. We will be happy to extend this help to manage your patient through our telemedicine platform. While with the increase in the scale and scope of testing, the number of positive cases are expected to increase. A significant number of these individuals will be positive, but fortunately asymptomatic. There will be a rise in the number of individuals requiring to be quarantined. To reduce the load on the healthcare system for handling such cases, we have launched the project Stay Isolation. This project has been launched in collaboration with hotel chains and corporates across the country. My team has also designed an online certification program for clinical management of COVID-19. This program discusses magnified view of COVID from epidemiology to disease prevention strategy. While the course is available at 5,000, I have decided to offer this free for all of you at this time. We'll share the enrollment process of this course in the next 24 hours, and this will be available for all doctors globally. We have also created a blueprint document which is compilation of evidence-based best practices from a clinical as well as administrative point of view to handle the COVID crisis. I have directed my team to share this information kit with all of you, and I am sure you will find this very useful. Alongside marching towards conquering this pandemic, it's a matter of great concern that on one hand, there are financial challenges that we are faced with, and due to drop of revenues to the tune of 60 to 70% or even more for some of you. And on the other hand, the healthcare professionals are facing social embarrassments. I am saddened and disappointed with the recent unfortunate series of incidents of violence against the workers. The most important incident of not allowing this final journey of a doctor is very unfortunate and shameful. I commend the efforts of the Indian Medical Association for standing united in restoring the dignity of medical professionals and seeking their safety. I am glad that government has brought in an ordinance yesterday through a cabinet meeting to amend the Epidemic Disease Act, making attacks on healthcare professionals a non-bailable and cognitive offence, punishable up to 7 years in a prison and a fine up to 5 lakhs. I'm happy to show you, way back in 2007, there was an incident in one of our hospitals, and I represented to then Chief Minister of Andhra Pradesh, Dr. Rajsekhar Reddy. He immediately enacted a legislation that is a punishable offence, and I'm happy that today we are having an act which is applicable throughout the country. We as Apollo Group, through continuous dialogue with the centre and state governments, Niti Aayog, Special COVID Task Force and other agencies have highlighted the strategic role of healthcare and our workforce. Various representations have been made to governments representing the need to strengthen healthcare infrastructure, invest in human health resources and medical equipment, focus on research and development projects for ensuring 100% safety of healthcare facilities. We have also conveyed an urgent need to implement a health-focused investment strategy and strengthening our most critical resources, doubling of our doctors, nurses and paramedics. To tide over financial distress, recommendations have been made especially to provide economic stimulus, lowering of GST down to 0%, inclusion of healthcare services in infrastructure category, and recommendations have also been made to fasten the release of 100% central taxes to state government dues the sectors of various schemes such as CGHS, EHS, state schemes, etc. And we have also approached the banks to give for at least 6 months to give us at a marginal interest rates to bring our efforts back into service. Further to the announcement made by the government ensuring public sector frontline workers against COVID-19, we appeal to the government to have the same benefit to private health workers who are also to be included in this under the insurance cover. While the world will never be the same again, we have an opportunity to build a better world. You believe it? We should believe. We are at an inflection point in our war against COVID, and together we will be victorious. I salute the spirit of each doctor, nurse, technician, paramedical staff, support staff, administrators, and all the unsung heroes. We are one family. And at all times, we must bear in mind that the world is looking up to us for solutions, and India reposes its trust in us. This is the highest honor and respect. Let us persevere harder. God bless. Namaste.